We became involved in volunteering through a charity in the northeast of Scotland called the Soapbox Collaborative. They had been working with the University of Aberdeen in where medical students went out to Ethiopia and did some clinical work out there. The feedback from the students when they returned to Aberdeen was that although their clinical work had been successful, they were really struggling with some key infrastructure problems, for example, that there was no running water. So they wanted to talk to some technical people at Aberdeen Royal Infirmary to see whether or not we could help. So they made contact through me and Hammy.
So we got our heads together, and what we decided was that this was something that we could perhaps get back on track for them. The water supplies, the electricity supplies, the issues they were having, the day-to-day things that normally in NHS Grampian in the maintenance infrastructure, what we carry out anyway. So it was agreed that we would volunteer to go across and try and help the hospital in Bahir Dar. Yeah, the message that we were getting was that there was no running water out within the hospital. So the main issue was to try and restore that water. Pleased to say that when we left the building after our 10-day visit, we had 90% efficiency of water running within the building again. My colleagues who worked on the electrical infrastructure.
We also had power cuts several times every day, and whereas in the UK that would be incidental or very very rare, and only for a few seconds, there it was for hours at a time, which clearly has got a major impact on the ability to care for patients. So we worked with the team there to restore those power supplies. There were other issues around hospital laundry facilities. They were washing all of the dirty and infected linen by hand because washing machines weren't working. There was lack of oxygen supplies due to lack of piped oxygen, and they had some issues with some medical equipment. So we worked with them during that 7 to 10 days to equip them with the skills to maintain those things after we left.
From my own experience, it was a fantastic, life-changing experience. And being able to go across there and find a hospital which had no running water at all, and end up with a situation where 90%, as we've said previously, that and to see the smiles on the faces of the people when they saw the taps working was absolutely fantastic. And certainly I gained a lot out of that personally.
And I guess the bit for me is that bit about what we take for granted here. You turn on the tap and it runs, and you switch on the light and it comes on. Yeah. And we don't have a sense of how important that is to the outcomes of patients in this country. Whereas there, we were very quickly able to see how the lack of those services could actually result in the death of patients, or the real negative outcomes for patients. So I took that away, how much we take for granted, and B, how important infrastructure and estates and maintenance is to the NHS.